everybody, just a quick update. This will be a short video. I did see my surgeon last week and we talked about some of the questions that I had. Actually, I talked to his physician's assistant. She was very nice. We went through all my questions and I'm still nervous, not gonna lie. We have 2 weeks until total knee replacement. And by the way, excuse my voice. I have a really bad cold that I'm getting over. It was really worse. I couldn't even talk yesterday, barely. At least I'm getting this cold over with now, and no, it's not COVID. Although I don't think people believe there is COVID anymore, but I took a COVID test anyway and came out negative. Just a simple allergy or cold season, I guess. Anyway, I had asked him a whole bunch of questions, and I won't go through all of them. Some of them are boring, but the whole point is I'm gonna probably have a 2 to 3 night stay at the hospital, hopefully more close to 2. They have to make sure I transition back to my blood thinners after surgery and make sure I have no blood clots and all those wonderful things. I also talked about pain medication because I'm concerned because I've had a reaction to hydrocodone before where it made me vehemently nauseous. So she said they'll prescribe me an anti-nausea with it, so hopefully that'll keep it under control. Looking forward to that. Hopefully it works. Sorry for my cough. I also asked about sleeping because everybody says you don't sleep the first couple of weeks. And they told me that, you know, they really don't recommend taking any kind of sleep aids because you're going to be taking the hydrocodone. That should make you sleepy. But sometimes the pain, you know, I guess makes you not be able to sleep. So I guess we'll just play that one by ear. But she said no, she doesn't think I should take any sleep aids at all. My left knee, which is also messed up, is not as bad as my right, the one that's getting total knee replacement, but the left knee is a little sore still, and it's kind of hard for me to go upstairs and stuff with both my legs right now. So I'm concerned about having the surgery on the right knee and then having the left knee to take the burden for a couple of weeks or whatever. So she gave me a cortisone shot, and I'm just praying that it works. I've had cortisone before where it did work, but now after 2 years of doing cortisone, it just doesn't seem to do anything for me anymore. And last year in July, I don't know if I told you guys this, I think I did. I had a cortisone shot in my right knee, and then a week later, my plantaris tendon ripped. And some people say that it's possibly because of the cortisone. So I'm just praying right now that the cortisone on my left knee doesn't make anything rip. I'm just being really cautious. I even canceled plans with friends, not just, I don't feel good, sick. I don't want to get other people sick, but because my knees are just I'm not good for sitting for a long period of time. We were going to do a gaming weekend, and I didn't think that was a good idea. I did ask about, you know, for pain management besides the hydrocodone, which I'm not really too thrilled about taking, but I will if I have to. I asked her about CBD creams because they seem to work for me. Like if I have a really bad cramp or a Charlie horse in my leg because of the arthritis right now, I'll put the CBD cream on it, and it kind of within minutes makes it feel so much better for me. So she said no, she has no problem with that as long as I don't put it on the wound, obviously. But if I have, you know, lower calf pain or something like that, I can use CBD. So I was very happy to hear that. I'm going to be doing a general anesthesia. I want to double check on that because some people do it's called a spinal block, I've heard, for knee surgery. And they actually do what's called I forget what it's called, like a leg block. So it only blocks the one leg, not the whole spine. So, but I will be totally out, so I won't know what's going on. So I'm glad to hear that. And I thought like I was all ready to go, but then she said, okay, now next week, so next week, I have to go back to see her again 1 week before surgery because they have to take x-rays. I don't know what they're called, like super x-rays. I'll find out the actual word for them. That actually measures your kneecap and all that kind of stuff so they can figure out which is the best knee replacement that they'll put in. So they're going to actually do some x-rays next week and then just go over everything again that we talked about yesterday, or not yesterday, last week. There's a lot to do before surgery. It's just more than I ever thought. Nothing bad, just a lot of things to remember. So I made myself a list. You know, next week I go there and I get the x-rays. Then the hospital called me and said, guess what? We need you here at 2 p.m. on blah, blah, blah day. And I'm like, oh God, I have a meeting at that time. And she's like, no, you don't, because this is more important. I'm like, oh my gosh, then I cancel a meeting for work. Work is driving me crazy right now as it is. And I only have 2 more weeks left before surgery. So I'm trying to get everything I can in and done. So I had to cancel that meeting. And basically I have to go to the hospital for 2 hours to do blood work and all these tests and things, plus educational seminar. The physical therapist is going to meet with me. they're gonna give me like a whole educational 2-hour program, including blood work. And I'm like, okay, I mean, it is what it is. It's better to be prepared than not. So that'll be interesting. Maybe I'll do a quick video on after I do that class. It's very, very interesting. But listen to this. So before surgery, right, I have to do physical therapy, which I've been doing on a daily basis. And I'm also going to Athletico to do it 2 times a week. On May 3rd, I have to start my Lovenox shots. I told you guys about that in the last video. I'll do that for 5 days. On May 1st, I have to stop taking all supplements. I can take my normal medication, but no supplements, like no vitamin C or anything like that. On May 3rd, I have to start this nasal thing called Bactroban. You actually put this stuff in your nose for 5 days. It's supposed to prevent MRSA or other types of infection, I guess. So I stick something up my nose. And then on May 6th, I have to start using HybaCleanse in the shower, which is a special antibacterial soap. I have to use that for 3 days and the morning of surgery. So it's like all these things I got to do. And I have to pack a bag, nothing drastic. It's a small bag for, got to bring some things to read and, whatever, a camera, to pack a bag for a couple of days. And the day before, it's very simple. You take a shower, no lotions, deodorants, or anything can be put on. They want you to sleep on clean sheets the night before. So I have to, make the bed over. I have to drink 32 ounces of an electrolyte beverage. That's actually called a pre-procedure hydration protocol. So I have to drink like 32 ounces of like Gatorade the night before, and then that morning I have to drink 8 ounces. It's supposed to increase hydration, decrease your nausea, decrease your anxiety, decrease pain, and decrease infection risk. So I'll drink it up. Then I have to take this pill the night before called gabapentin. It's a nerve medication to help nerve pain. I'm like, okay. And then it turns out I have to take that after the surgery for like a month or something after that. I forget what that said, but something like that. Don't eat after midnight, of course. And then the day of surgery, I have to drink that water, that Gatorade again. Wear shorts or sweatpants, which I got those cool pants with the buttons on them. And that's it. Then surgery happens. When I get home, I have home health care that comes for 2 weeks. They're going to send me home what's called a CPM machine, which actually moves your leg back and forth. And I'll show that when I get it, how that all works. An ice machine to ice my knee. And then when I get home, I just got to wear these TED hose. I think they're like a compression hose. Keep blood clots away. I can't get it wet for 2 weeks. I have to use a waterproof covering, which I bought on Amazon. I have to ice it 30 minutes per session. Oh my gosh, there's just so much. And no driving until all my narcotics are done and my reflexes are good. So I'm not going anywhere. Phil do that. So it's gonna be a lot. It's a lot to think about here, but I have it all organized. I'm pretty good at organizing and getting everything ready. So we'll see how it goes. So this week I have the 2 appointments, one with the doctor for the x-rays and then the hospital for the 2-hour educational seminar. Meanwhile, I have to work in the meanwhile. And that's another story for another day, but work is a little stressful right now, and I'm just trying to put that to the side and focus on my surgery and recovering. At least I'll have 2 months, at least 2 months to do that, so that'll be good. So that's not the most exciting video, but I wanted to kind of give you guys an update. By the way, the last video got a ton more views than the first 2 videos in this series. I was like, I wonder, maybe because it said I had my braces off. I don't know, because the title was weird. Clickbait, I don't know. I wasn't trying to be clickbaity, but I just put what was the story about the video. So it's pretty cool. Thanks for those who watched it. Hopefully you guys are watching this one. Please feel free to go back and watch the very first one, which explains everything I'm going through, and it shows what I'm, how I'm setting up for it. If you're curious about knee replacement surgery, I appreciate anybody who does watch the videos, and I'll talk to you guys hopefully during the week again, and then we only have 1 more week after that, to go for surgery. I get nervous. All right, guys, thanks so much. We'll talk to you later. Hope you have a good weekend. Bye.